Hi everybody, I am Dr. Neelima. I am consultant gynecologist and my passion is laparoscopic surgeries, and I do robotic surgeries also. I am a trained robotic surgeon. Today we shall talk about the most common problem which is seen in females, that is fibroids. So let us know what are fibroids. Fibroids are nothing but benign tumours, that is they are non-malignant tumours. Non-malignant in the sense they are non-cancerous tumours which arise in uterus, which we commonly call as the womb, that is. So these fibroids arise from the muscle of the uterus, and these are usually asymptomatic and are seen in almost 20 to 30% of women of reproductive age group. And these fibroids usually they do not require treatment, but sometimes these fibroids may cause symptoms or may increase into like giant fibroids which require treatment. So when do these fibroids require treatment? So when these fibroids causes symptoms like heavy menstrual bleeding, that is during the periods the normal duration of flow is around 5 to 8 days. When the periods is more than 8 days, or the number of pads which the woman is changing is more than 3 pads with excessive flow, and when there are too many clots in the menstrual flow. So these situations we have to treat the fibroids, or sometimes these fibroids can cause intermenstrual bleeding. The intermenstrual bleeding means in between the periods the woman may have little spotting or sometimes moderate flow or on and off bleeding in between the periods. This is called intermenstrual bleeding. So when there is intermenstrual bleeding, or sometimes these fibroids can cause infertility also. So they may sometimes interfere with the conception and cause infertility to women. And very large fibroids can sometimes cause pressure symptoms like urinary retention, constipation and so on. So when these fibroids are causing symptoms, or when they are very large like giant fibroids, or when they are causing infertility, these require definitive treatment. There is no certain medical treatment for fibroids. So the medical treatment is usually temporary, and the definitive treatment is always surgical removal. And when do we plan surgical removal? So it depends on the size of the fibroid, the location of the fibroid, the age of the patient, whether the woman requires fertility, and whether it is causing symptoms. So all these things are taken into consideration when we are deciding the modality of the treatment, that is the surgical management. Thank you.